All right, let's talk about medical websites. But look, this isn't going to be your typical marketing chat. We're going to dive into how, especially as we look ahead, a medical website has to be so much more than just a digital brochure. It really needs to function like a clinical tool, one that's designed to ethically bring in new patients by building instant, undeniable trust.
So to really get this, we have to put ourselves right in the patient's shoes. Just imagine for a second. You've got some new, weird symptom. It's kind of worrying you. What's the very first thing you do? Before you call anyone, before you talk to family, where do you go? Yep, you go straight to Google. We all do. And in those first few seconds of searching, the decision to click on a link, to read a page, and ultimately to book an appointment, it all boils down to one single thing: trust. Trust is the absolute currency here, and honestly, it's where most websites completely fall short. This means we've got to completely shift how we think about our websites. They're not just some marketing asset anymore. They are the new digital front door to your practice. Every single thing on that site, from the color of a button to the title of a page, has to be seen through a clinical lens. It all has to pass one critical test.
And that test, it's called EAT. That stands for expertise, authoritativeness, and trustworthiness. Now, this isn't just some buzzword Google threw out there. This is the core principle, the absolute bedrock for ethically acquiring patients. From now on, every single choice you make about your website has to be laser-focused on proving these three things.
So, where does this go wrong for so many practices? Well, they jump straight to the pretty stuff. The colors, the logo, the layout. And yeah, that stuff matters, but starting there is a huge mistake. The professional approach, the one that actually works, always starts with strategy. You need to have a crystal clear mission before you even think about mockups.
Just take a look at the night and day difference here. On the left, you have this vague, fluffy claim that honestly means nothing. It builds zero trust. But on the right, that's an ethical, evidence-based USP. It's super specific, it tells you the exact methodology, it points to verifiable credentials, and it speaks directly to a certain kind of patient. See? That's how you build trust in just a few seconds.
Okay, so let's say you've nailed your strategy. Awesome. But even the most trustworthy website on the planet is, well, it's pretty useless if a patient can't find it when they're worried and searching for answers, right? This brings us to the absolutely crucial world of SEO, or search engine optimization. For any local practice, this is a concept you have to get right. Your website and your Google Business Profile, they're not two separate things. You need to think of them as one single interconnected ecosystem. Your website's design has to be built from the ground up to support and boost your Google Business Profile. Let's break this down into three simple but super powerful rules. First, your name, address, and phone number, your NAP, it has to be perfectly identical everywhere online. Second, your phone number has to be clicked to call on a mobile device. No excuses. And third, you need an embedded map on your contact page. These aren't just little features, they are massive trust signals to Google.
And this is all about thinking like a patient. People don't search for medical billing codes, they search for their pain. They're typing in non-surgical solutions for sciatica. Your page titles, your headings, they have to speak that language. And if you really want to level up, use something called schema markup. Think of it like code that tells search engines, hey, this page is a legit medical resource from an expert.
All right, let's switch gears and talk about content. Because in the medical world, content is so much more than marketing. It's the main way you prove your expertise, authoritativeness, and trustworthiness. It's the engine that powers your EAT.
This means your website's design absolutely must include these things on any page with clinical information. Every article needs a clear author bio with their credentials right there. A medically reviewed byline with a recent date, that's a huge trust signal. You have to cite your sources, and you need a clear disclaimer. These are basically the must-haves for credible medical content online now.
Okay, let's tackle a tricky one: patient stories, testimonials. They can be incredibly powerful for building that trust we've been talking about, but you're wading into some serious ethical and legal waters here. You have to handle these with a ton of care.
So here's a really simple protocol to keep you safe and ethical. 1. Keep all these stories on their own dedicated page. 2. Always get explicit written consent. 3. Focus on things you can measure, functional outcomes, not just vague feelings. And 4. For anything sensitive, use anonymized case studies. It's the best way to protect your patients and your own credibility.
Okay, so the patient found you, they trust you, they believe you're the expert. Now what? We have to make it ridiculously easy for them to actually book an appointment. Your booking system can literally make or break their decision to come see you.
And it all starts with speed, specifically under 2 seconds. Your site has to load in under 2 seconds on a mobile phone. Any longer, and you're going to lose that patient who is ready to book, maybe forever. Speed isn't a feature, it's a sign of respect for your patient's time.
The blueprint for zero-friction booking is actually pretty simple. First, a big, obvious book appointment button needs to be on every single page. Second, integrate your booking system directly into your site. Don't send people to some third-party website. That just creates confusion. And third, be upfront about insurance. Answer their financial questions before they even have to ask.
And beyond booking, there are a few other pages that are just non-negotiable for building trust. You need a detailed privacy and HIPAA policy page. That shows you're serious about compliance. Your contact page should have actually helpful info, like where to park. And you know what? A short Meet the Practitioner video is an amazing way to humanize the whole practice and calm a patient's nerves.
Now look, once the site is live, the job isn't done. Not even close. You have to constantly track its performance. But it is so important to look past the vanity metrics, like how many people visited a page. You need to focus on the data that actually impacts your practice.
These are the numbers that really matter. What percentage of your website visitors are actually booking an appointment? How much does it cost you to get one new patient from, say, Google Ads? And are people taking important actions, like clicking the button for directions to your clinic? This is how you measure what's really happening.
But all that digital data is only half the story. There's one final critical piece of the puzzle that you have to solve. You have to know, for sure, where your new patients are actually coming from. You have to close the loop.
And the solution is so simple it's almost funny. It's this one question. You have to make it a mandatory part of your new patient intake process. How did you first hear about our practice? This is your ground truth. This simple question verifies all of your fancy digital data and makes sure your marketing dollars are being spent wisely.
Whoa, okay, I know that was a ton of information. We covered strategy, SEO, content, booking systems, the whole shebang. It can feel pretty overwhelming. So the big question is, where on earth do you even begin?
You start right here. Forget everything else for a second. Your Google business profile is the front line. It's often the very first impression a patient has of you. So audit it today. Check if your name, address, and phone number are perfectly consistent. Update your photos. Respond to your reviews. Strengthening this one single asset is the most powerful first step you can possibly take.